To the latest health situation in the country, where health services in various hospitals across the country remained grounded after the Kenya Union of Clinical Officers and Kenya National Union of Nurses made good their threat to proceed on strike beginning Monday. The healthcare workers are decrying, among other grievances, shortage of personal protective equipment, lack of risk allowance and delayed promotions. But opposition leader Raila Odinga is appealing to the striking health workers to reconsider their actions, saying it is not the right time to paralyze the health sector when the country is battling the coronavirus pandemic.
This was the situation at the Migori County Referral Hospital. Patients left stranded following the ongoing strike by nurses and clinical officers that began Monday morning countrywide. The health workers are accusing both levels of government of giving them a deaf ear on the issues touching on their welfare. According to the leadership of Kenya Union of Clinical Officers and that of Kenya National Union of Nurses, there is a shortage of personal protective equipment in various health facilities across the country, putting many frontline workers at risk.
For the longest time, and this is not new to our government, is that we have raised several issues which we call them pertinent healthcare issues in this country. And we have said, number one, that healthcare workers must be provided with adequate and high-quality personal protective equipment.
The healthcare workers are also seeking risk allowances and promotions, among other demands.
As healthcare workers, especially the nurses, who are close to the patients, their plight has been ignored for long. We have been tabling our demands and issues to both levels of government with no tangible response from both governments.
The two unions have vowed to boycott work until the government addresses their grievances, even as their counterparts, the Kenya Medical Practitioners, Pharmacists and Dentists Union, suspended their planned strike for at least 2 weeks to allow room for negotiation. Meanwhile, ODM leader Raila Odinga has called on the nurses to reconsider the industrial action and instead focus on service delivery, especially during this pandemic period. Raila, while accompanied by the Council of Governors Chair Wycliffe Oparanya, said the pandemic had battered every sector and any resource mobilization will prove difficult at the moment.
This is not the time, really, to hold the government to ransom. And the doctors themselves take an oath to protect life. How then do you justify downing your tools when people are dying, lives which you can actually save? So I want our doctors to become more realistic and more understanding that though they are suffering, it's not only doctors who are suffering. You've got the teachers, you've got the engineers, you've got the lecturers.
Wycliffe Okech, Channel 1 News.